Hello everyone, welcome back to a new series of Pharma MCQ discussion which is mainly concentrated for the GPAT exam. However, it would be highly useful for other pharma related competitive exam as well as. So this series is called as GPAT 1000 MCQ series. So here every day there will be 5 questions in each discussion. It will cover all the subjects from the syllabus. There would be easy tips and tricks to remember the concept, and the discussion would be effective to make the concepts clear. Also, we are quite happy to announce that there would be a complete course for the GPAT exam that would be launched soon. So stay tuned and update with us. So without any further delay, let's move on to the first question of the day. So the first question is, which of the following amino acid is the starting material for the biosynthesis of heme in the body? A. Glycine, B. Tyrosine, C. Aspartic acid, and D. Glutamic acid. So the first thing you need to know, heme is a part of the protein hemoglobin. Hemoglobin contains the heme, which is the non-protein part, and the globin part. Now the question is, from which compound or which molecule this heme is synthesized? So basically this heme is biosynthesized in our body from an amino acid. And what is that amino acid? So this is the pathway for the heme biosynthesis in the body. So as you can see, the amino acid, the simplest amino acid called as glycine, along with the succinyl CoA are the starting materials for the biosynthesis of heme in the body. Okay, so that is the first thing you need to know. The starting material for the biosynthesis of heme is the amino acid glycine and succinyl CoA. Now, after a lot of steps, this glycine and succinyl CoA would be converted to heme in the body. Now, the first step, that is the glycine converted to delta ALA. What is the delta ALA? Delta aminolevulinic acid. So that is the first step. Glycine converted to delta aminolevulinic acid, with the help of which enzyme? That enzyme is called as ALA synthase or delta ALA synthase. So the second point you need to remember, the rate limiting enzyme in the biosynthesis of heme. The rate limiting enzyme in the biosynthesis of heme, the answer is ALA synthase. Okay. So that is the second point you need to remember regarding the biosynthesis of heme. Now the third point you need to remember, where does this biosynthesis of heme occurs in the body? So remember, as you can see from this figure, this is the mitochondria, as well as this region is the cytoplasm. Okay, so heme biosynthesis happens in mitochondria as well as cytoplasm. Okay, half of the step happens in the mitochondria, and remaining half steps happens in the cytoplasm. So it is a combination of mitochondrial location as well as a cytoplasm location where the heme biosynthesis happens. So which amino acid is the starting material? The answer is the simplest amino acid, glycine. So the correct answer for this question is heme is biosynthesized from glycine. Now you look at the choice B. This tyrosine is the precursor for which all important compounds in the body? Yes, noradrenaline. Tyrosine is the starting material for noradrenaline, adrenaline, dopamine. Okay, so remember, tyrosine is the precursor for the catecholamines or the neurotransmitters like adrenaline, noradrenaline, and dopamine, where glycine is the starting material for the synthesis of heme in our body. Okay, so hope you understood the first question. Let's move on to the second question. Which of the following is a nucleotide reverse transcriptase inhibitor? Read the question very carefully. Nucleotide reverse transcriptase inhibitor. A. Zidovudine, B. Lamivudine, C. Both A and B, D. Choice tenofovir. If you carefully look at the choice, you can understand that these drugs are basically anti-HIV drugs. Anti-HIV drugs. Okay, so you know that in the treatment of HIV, one of the mechanism to treat HIV is that use reverse transcriptase inhibitor. Reverse transcriptase inhibitors are one of the treatment strategies to deal with the HIV virus. So reverse transcriptase inhibitor, they are nothing but they inhibit the enzyme called as reverse transcriptase. Now they are of two types: competitive reverse transcriptase inhibitor and non-competitive reverse transcriptase inhibitor. Now this competitive reverse transcriptase inhibitor are also called as NRTI. NRTI. Whereas the non-competitive reverse transcriptase inhibitor are also called as NNRTI. NNRTI. Now, what is NRTI? NRTI is nothing but it could be either nucleoside reverse transcriptase inhibitor, or it could be nucleotide reverse transcriptase inhibitor. Okay. So remember this word nucleoside and a nucleotide. What is the difference between nucleoside and a nucleotide? Nucleoside is nothing but base, nitrogenous base and sugar only. Whereas what is nucleotide? There will be base plus sugar plus the phosphate group. Okay, so that is the difference between nucleoside and nucleotide. Now, which are the drugs coming under nucleoside reverse transcriptase inhibitor? The answers are zidovudine, lamivudine. That the name of the drug ended with the woodine, lamivudine. Then comes stavudine. The name of the drug ended with the VUDINE. Next, didenosine, abacavir, zalcitabine, emtricitabine. So these are the drugs which belongs to nucleoside reverse transcriptase inhibitor. They are NRT. NRTA could also be nucleotide. The phosphate group also could be there. And only you need to remember one drug which comes under nucleotide reverse transcriptase inhibitor. Name of the drug is tenofovir. So tenofovir is NRTA, but that N stands for nucleotide because it contains phosphate group also, tenofovir. Okay. Now, what are the non-nucleoside? NNRTA means non-nucleoside reverse transcriptase inhibitor. And which are the drugs coming under that category? The answer are efavirenz. Efavirenz is an NNRTA. Efavirenz. Then nevirapine, delaverdin. Then comes the rilpivirine. Then etravirine. The name of the drug ended with the virine. Etravirine, doravirine. Okay. You can remember this mnemonics and END. Efavirenz, nevirapine, delaverdin. And here you can remember RED, red. Remember, this efavirenz, nevirapine, and delaverdin are first generation NNRT, whereas this red one, that is rilpivirine, etravirine, and doravirine, they are second generation NNRT. Okay. So these are the reverse transcriptase inhibitor. The question here, what they have asked was a nucleotide reverse transcriptase inhibitor. You remember, zidovudine, lamivudine are nucleoside. So the correct answer here would be tenofovir. Okay, tenofovir contain a phosphate group. So that is why it is nucleotide reverse transcriptase inhibitor. Okay. Let's move on to the third question. Bioavailability of a drug means is 40%. Bioavailability of a drug is 40%. Bioavailability of a drug is 40%. What does it mean? A, 60% of the drug undergoes first pass metabolism. B choice, 40% of the drug reaches the systemic circulation in unchanged form. C choice, both A and B. D choice, the drug is 40% potent in producing the therapeutic effect. So the question is bioavailability. So what is bioavailability? So you know that the amount of drug reaches the systemic circulation, the amount of drug that reaches the systemic circulation, the blood, that is called as bioavailability. Suppose orally you give 100 drug, 100 quantity of drug. Suppose in the blood, this imagine only 50 has reached. So if you give 100 100 quantity of drug in the blood, only 50 has come. So what is that bioavailability? We will tell that it is the drug is 50% bioavailable. So what happened for the remaining 50? So only 50 has reached. Although you gave 100, only 50 has reached. So what happened to the 50? It could be unabsorbed. So that remaining 50 would be unabsorbed and could be excreted as such. Okay, so that would not be absorbed, that would not reach the blood, or it could be metabolized by liver before reaching the blood. That is called as first pass metabolism or pre-systemic metabolism. Or first pass metabolism. Okay, so that is the fate of the drug. Out of 100, 50 might be lost either through first pass metabolism or it would be excreted as such. Okay, now here the question was, what is 40% bioavailability? So 40% means 40% bioavailability means when you give 100, only 40 has reached the blood. Only 40 quantity has reached the blood. So what happened for the remaining 60? Either it would be unabsorbed or it could undergo first pass metabolism. Okay, now look into the choice. A choice, here 40% bioavailability means here in the A choice they are telling 60% of the drug undergoes first pass metabolism. Is that correct? That 60 could be undergoes either first pass metabolism or it could be a combination of first pass metabolism or the drug will be unabsorbed. So it is not only first pass metabolism, that drug can also get unabsorbed. So that choice is not correct. Now look at the B choice. 40% of the drug reaches the systemic circulation in unchanged form. So the correct answer is B choice. 40% of the drug reaches the systemic circulation in unchanged form. Don't go for the C choice, because if you look at the A choice, they have given that first pass metabolism 60% drug has been lost. Not only first pass metabolism, it could be unabsorbed also. We don't know that. So that is not the best choice. So don't go for both A and B. The best answer would be B choice. I hope you got the discussion, understood the discussion. Now let's move on to the next question. Universal antidote contains A. Zinc oxide, B. Tannic acid, C. Charcoal, D. All of the above. So regarding universal antidote, you need to understand a couple of things. Now, whenever poisoning happens, one of the procedure to tackle the poisoning is gastric lavage. Gastric lavage. Gastric lavage is nothing but a kind of stomach wash, washing the stomach wash. Okay, so that you can completely remove that poisons from the body, so the patient will be better. So it's a kind of a treatment for poisoning. Now, universal antidote is sometimes used in this gastric lavage. Universal antidote would be used sometimes in this gastric lavage for treating the poisoning. Now, what is universal antidote? So it basically contains three compounds. You can remember this mnemonic ATM. ATM. What does A stands for? You activated charcoal. A stands for activated charcoal. Activated charcoal. T stands for tannic acid, and M stands for magnesium oxide. Either it could be magnesium oxide, sometimes zinc oxide also could be there. Okay, so you can remember this mnemonic universal antidote ATM. ATM is present all over the world, right? So ATM you can remember. Now, what is the second question? What can come? What is the ratio of this components in the universal antidote? So you can remember 2 parts of activated charcoal, 1 part of tannic acid, and 1 part of magnesium oxide. So the ratio is of ATM. The ratio of ATM is 2 is to 2 is to 1 is to 1. Okay, so that also you can remember. Now, what is the function of this activated charcoal? So basically, activated charcoal will help to absorb the poison on the surface. Absorb the poison on the surface. That is a function of activated charcoal. So normally it is used at a dose of 1 gram per kg body weight. 1 gram per kg body weight. Okay, so that also could be asked for the exam, and it is an example for this. Activated charcoal is an example for physical antidote. It is an example for physical or mechanical antidote. Physical or mechanical antidote. Okay, and what is the function? How it is helpful for treatment of poisoning? It absorbs the poison on the surface. Now, why tannic acid is used? So tannic acid basically causes the precipitation of alkaloids. It causes the precipitation of alkaloid like compounds. Now, what is the function of magnesium oxide? They can actually oxidize. It causes the oxidation of alkaloidal compounds. Oxidation of alkaloidal compounds, or it can neutralize acids. Neutralize the acids. Okay, so that is the function of magnesium oxide, either oxidation of alkaloid or neutralization of acid. Whereas tannic acid, the function is precipitation of alkaloids, whereas activated charcoal absorb the poison on the surface. So here the question was the components. So ATM, activated charcoal, tannic acid, and they have given zinc oxide. Zinc oxide can be used instead of magnesium oxide. So the correct answer for this question would be all of the above, D choice. Let's move on to the next question, the last question of the day. Which of the following anesthetics contain 7 fluorine atoms? So you know that N-fluorine, isoflurane, sevoflurane, all these are nothing but general anesthetics. Okay, so among these general anesthetics, which general anesthetics contain 7 fluorine atoms? So the first question, so remember, all these fluorine drugs, the name of the drugs end with fluorine, they are nothing but halogenated ethers. They are ether compounds and it contains halogens. So that is why all these fluorine compounds are belong to a class called as halogenated ethers. Now let's look into the first choice, N-fluorine. So I told you they are halogenated ethers. So basically the structure of the compound would be like CC, oxygen, carbon. So they basically CH3, CH2, oxygen, carbon. That is a ether compound, right? Now in N-fluorine, this carbon contains 2 fluorine atoms. This carbon also contains 2 fluorine atoms. And this carbon contains 1 chlorine, 1 fluorine. And just you need to balance the compound. So this is the structure of N-fluorine. So how many fluorine atoms are there? 1, 2, 3, 4 and 5 fluorine atoms. Okay. Now coming to isoflurane, as the name indicates, iso, that means it is an isomer. It is an isomer of N-fluorine. So the structure is almost similar. You need to write carbon, carbon, oxygen, carbon. This carbon contains same as that of N-fluorine, that means 2 fluorine atoms. However, from this this last carbon, this chlorine and hydrogen would be shifted to here. Chlorine and hydrogen would be shifted to here, whereas the 2 fluorine atoms would be shifted to this side. Okay, so basically it's an isomer of N-fluorine. Okay, so here also what would be the total number of fluorine atoms? Since it is an isomer, same, 5 fluorine atoms would be there. Okay, now what was the last choice? The answer is, so definitely the answer would be sevoflurane, right? And let us look into the structure of sevoflurane. So sevoflurane, again, they are halogenated ethers. You need to write carbon, carbon, oxygen, carbon. Here this carbon contains only one fluorine atom, remaining would be hydrogen. However, this carbon contains CF3, and here hydrogen, and this carbon also contains 3 fluorine atoms. Now you calculate the total number of fluorine atoms: 1, 2, 3, and this one 4. However, this carbon is CF3. That means 4 plus 3, totally 7 fluorine atom is there in the sevoflurane. However, you can no need to remember the structure. You can remember sevo. The word starts with SCV. That indicates 7. Okay, so how many fluorine atoms are there in sevoflurane? The answer is 7 fluorine atom. How many fluorine atoms are there in N-fluorine? You can remember N starts with the letter E, the alphabet E. And you know that the alphabet E is A, B, C, D. It is the 5th alphabet, right? So 5 fluorine atoms. You can remember like that. Okay, and isoflurane is the isomer. So definitely that also contains 5 fluorine atoms. Whereas sevoflurane, sevo indicates 7 fluorine atoms. So what would be the correct answer? Yes, it is a D choice, sevoflurane. So hope you understood this discussion session. Keep on watching. Thank you so much.